now turn the call over to Kathy Harbin. Thank you. You may begin.
Thank you, Denise, and thank you everyone for joining us today for an update on the investigation of severe pulmonary disease among people who use e-cigarettes.
Our discussion today starts with EVALI. EVALI is the US CDC, or Centers for Disease Control, name for the dangerous lung illness caused by e-cigarettes and vaping. Coincidentally, EVALI's symptoms are very similar to those of the pneumonia resulting from COVID-19 novel coronavirus. The handling of hospitalized patients is similar in each case, those of EVALI and those of the COVID pandemic. Despite the lack of any direct link between bacterial or viral lung damage to EVALI damage, the similarity of the symptoms and their treatment is causing medical comparisons in treatment procedures. EVALI stands for e-cigarette or Vape-Associated Lung Injury, EVALI. It's sometimes also called Vaping-Associated Pulmonary Injury, or VAPI. The diagnosis for EVALI is based on lung infiltration following reported chest pain visualized in X-rays or CT scans that show opaque or dark shadows on the inside of the lungs. University of North Carolina School of Medicine head and neck specialist Willard Harrell reports parallels between last year's widespread vape-related lung injuries and the coronavirus pandemic of this year. Quotes, "Faced with the evolving COVID-19 pandemic," end quotes, Harrell wrote in a comment in a medical journal that it's easy to forget last year's very relevant epidemic of e-cigarette or vaping product use-associated lung injuries, EVALI. Harrell used temperature maps of the United States to demonstrate a strong correlation between the geographical concentration of EVALI illnesses last year and COVID illnesses this year on a state-by-state basis. Both illnesses had outbreak hotspots in California, Texas, Florida, New York, and Illinois. Harrell also postulated that the COVID epidemic might contribute to a new increase in vaping and smoking problems.
Thank you everyone for joining us today for an update on the investigation of severe pulmonary disease.
Let's take a look at two Ivali cases. Remember, Ivali is the e-cigarette or vape-associated problem. Case 1 dates to September 2019, and here's a photo for that. The 27-year-old patient in this case had shortness of breath and hypoxemia, or low blood oxygen levels. The X-ray shows nonspecific parallel instances of darkened areas in the lungs' airspace cavities. The chest CT scans showed scattered darkening reflections of tissue damage inside both lungs. Now, case 2 took place just 1 month later in October 2019, and here's a photo for that. Heart and throat imaging in this case shows lung damage resulting from e-cigarettes and vaping. Report authors Dr. Sunhee Abara and Dr. Fernando Uliana K. from the Radiology Department of the University of Texas, Southwestern Medical Center in Dallas, have reviewed a number of recent cases of e-cigarette lung injuries. In one case that they highlighted in their report, Drs. Abara and Kay presented X-ray and CT images of lung injuries in a 24-year-old male with a medical history of asthma, who had reported shortness of breath, productive cough, chest pain, and fever over a 1-week period. Biopsy specimens taken from the lower right lobe suggested lipoid pneumonia, and the patient was prescribed steroids on a diagnosis of lung injury due to e-cigarettes. On April 8th, UN Secretary General Antonio Guterres called for a full scientific investigation to be held into the origins of the novel coronavirus after the end of the pandemic. So far, some US officials appear to have been trying to avoid an international investigation into the coronavirus epidemic, but there has not yet been enough elaboration about their reasoning behind their stance. However, with the ongoing testing of presumed COVID-19 sufferers, medical statistics should start to show a correlation and a deviation between the hospitalizations for EVALI, that means e-cigarettes and vape-induced injuries, and the hospitalizations for the novel coronavirus COVID-19. Eventually, some data should also appear for anyone who is hospitalized with simultaneous lung damage due to both EVALI and COVID-19. The COVID-19 pandemic has terrified people around the world, but the fact that a growing number of otherwise healthy individuals are being hospitalized with nearly identical life-threatening conditions due to EVALI has not yet broken into the mainstream media. Whether their relative silence on this topic is intentional is now drawing interest among truth seekers in the independent media. Doing a little bit of digging, a quick search of financial data shows that America's disgraced big tobacco industry agreed to a settlement of more than $1/3 of $1 trillion to be paid out to state governments to help care for the surviving victims of deceptive sales and marketing tactics by the tobacco lobby, by which they downplayed the health threat caused by smoking and simultaneously used cash incentives to promote cigarettes and tobacco use in advertising, media, Hollywood, and public discourse in the aim of maximizing their profits. And that meant maximizing profits from an industry that their own testing had proven to constitute a health hazard and cancer risk to all users of all ages. That was way back in the 1990s. Now let's jump ahead to today. It should not come as a surprise to discover that the tobacco industry lobby has resurfaced today as the single biggest investor in both e-cigarettes and vaping, trying to continue sales of a product that turns out to be deadly no matter which way you ingest it into the human body. Let's look at the numbers. Recent statistics show that tobacco sales still turn an annual profit of roughly $36 billion, while claiming the lives of about 6 million people per year. Or, let's put it this way, one rerun of the Holocaust every single year. If you do the math to break down Big Tobacco's profit per dead tobacco user, it comes out to about $6,000 profit per year per corpse. 666. That sure is a lot of sixes. There'll be lots more to come on this topic as we dig deeper into the dark shadows of the tobacco cartel, a lobby known as one of the big four US political lobbies, along with Big Oil, Big Pharma, and the military-industrial complex. Much more to come.
I will now turn the call over to Kathy Harbin. Thank you. You may begin.
Thank you, Denise, and thank you everyone for joining us today for an update on the investigation of severe pulmonary disease among people who use e-cigarettes. We're joined today by CDC's Ileana Arias. She's Senior Scientific Advisor and Acting Deputy Director for Non-Infectious Diseases at CDC. She will provide an update on CDC's support for the investigation.